Hello, everyone. I'm Barbara Ham-Lee. College football game, tailgating, drinking to excess. Some say it's a rite of passage for college kids, and at some point, everybody does it. Student binge drinking is usually thought of as an issue on predominantly white college campuses. But if you think it doesn't happen on HBCU campuses, think again. Black and white students party and drink differently, but it could all lead to the same negative results. We're talking about binge drinking and its effects on the body and mind. Another View on Health is next, right after this news from NPR.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. Before we get started today, just want to tell you about an experience I had yesterday. I had the opportunity to get a tour of the art, which is down in the Selden Arcade in Norfolk, downtown Norfolk, and the individual artists who are there making beautiful artwork, all different kinds. So as you can think about your holiday shopping and so forth, you know, the whole push is to shop local. So don't forget about the art. It was a really great experience and some beautiful artwork, and there's a lot of good things going on there. So if you haven't been, go down and check it out. A study of student behavior sponsored by the Century Council and conducted by Morgan State University in Baltimore says 54% of full-time HBCU students who drink at least once a week and go out socially at least twice a week engage in binge drinking. That number is 64% for students at non-HBCU campuses. The National Institutes of Health Statistics says that more than 1,800 college-age students a year die from alcohol-related injuries. And in the overall population, 40,000 people a year die from binge drinking. So what are we seeing here in Hampton Roads? Joining me to talk about it is my co-host of Another View on Health, the cardiologist, Dr. Keith Newby. Hi, Dr. Newby.
How are you?
I'm doing great. How you doing?
I'm doing well.
And Dr. Clarence Clarke, an emergency room doctor at Bon Secours DePaul Medical Center. Dr. Clarke, welcome.
Welcome. Thank you for welcoming me.
Thank you. We're so glad to have you. So let's start out, first of all, with the definition. And I'll start with you, Dr. Clarke. What is binge drinking?
Binge drinking is when you indulge in a large consumption of alcohol in a particular social event, or it could be privately. You consume a large quantity of alcohol. There's no necessary volume that you consume, but you continue to consume a significant quantity where your impairment is completely off.
And the difference between that and alcoholism, I mean, when we're talking about binge drinking, you're talking about at a particular setting. Is that right?
Yes.
So at that event, you drink a lot.
Yes.
Is that's what we're talking about. The CDC, I think, has it now that it's 4 drinks for women and 5 drinks for men.
Yeah, per hour.
Per
2
hour.
hours or 2 hours.
Over a 2-hour period, that would be considered binge drinking.
I think in the end, though, the important thing is that
Newby.
I think what Dr. Clarke's point was in the end was that blood alcohol level has to be a certain amount to consider. You know, as part of binge drinking is you have to get that level up there. I think it's 0.08, if I'm not mistaken, grams per deciliter of alcohol in the bloodstream, and that kind of constitutes, because you're drinking enough to get it up there, and that's what they kind of constitute. But they look at it because women have a slower absorption of alcohol, but it lasts longer in the system. So that's why they said 4 drinks for women and 5 for men.
And 5 for men. So explain then, what's the difference between that and alcoholism?
Well, I think in the end, it's just a matter of what's considered
degree?
Dependency.
Okay.
Really is, I guess, at least, and again, Dr. Clarke, correct me if you think I'm wrong on this one, but my understanding is that if you're, if you wake up thinking, I got to have a drink, that's considered dependency on alcohol versus the binge drinker, which is typically they're going to an event. They go
tie one on, as they say.
They may, any other time, they may not drink much at all, but you get them to like a tailgating party or a social event, and I'm going to hit it, and I'm going to hit it hard, and then I'm going to drink up to a certain level, and then they go about their way. But the next day, they may not have another drink for another event. So I think that's, if I'm not mistaken, I think that's where we are.
Dr. Clarke?
I would agree with Dr. Newby. I find that when people are binge drinking, they really do not consider themselves to be alcohol dependent or alcoholics, to use another term. What they do find is that binge drinking can be over a period of days, or I would say it's not just limited to one particular event. You have people who just drink on the weekends and they consume large quantities on a weekend. On our historically black universities, you find that they are drinking more at the social events, and sometimes they're doing it on Thursday through Sunday.
Thursday through Sunday. So every day they're doing that.
After classes are over. I'm a graduate of HBCU, and that's what I found when I was on campus as well.
Mm-hmm. So according to the CDC, also binge drinkers in general, and before we get to specifically about college kids, usually between 18 and 34, but also 65 and older. Where do you attribute, and household incomes of $75,000 or more tend to be, if you're going to be a binge drinker, you tend to have that kind of salary.
Yeah, I'm not sure about why the older person, other than sometimes we drink for various reasons. Sometimes it's loneliness, or whatever, and it may be in that group because you talk about everybody's gone and you're just there by yourself, or in certain situations. I mean, again, this is just pure speculation. I'm not familiar with that particular piece of data, but I definitely understood the first comment, but the second one not so much. So I'm not sure why. I don't know, Dr. Clarke, you have any
insight on that, Dr. Clarke?
I would question some of the data, given the fact that this part of my routine screening questions when I'm seeing patients in the emergency department. A lot of people tend to minimize when you ask them the questions about smoking and alcohol and other illicit drug use. Particularly, you find that they say, oh, well, I only drink at social events. If you dwell deeper into the question, they will sit there and they'll say, well, I only have a couple drinks, one or two, but then they start to elaborate a little bit more as they become more comfortable with you. And I find that it's not really restricted to that $75,000 income limit, that you find people who are binge drinking just to deal with the different stresses that they're experiencing in their life. You can have people who are making less than $20,000 a year who are drinking significantly.
Well, I was going to say, because I can't think of many college students that would be making $75,000 a year either while you're in college. But we know that population has a problem with binge drinking, and things that go on there. A study, as I was talking about in our introduction, was done by Morgan State University. They found that 54% of full-time HBCU students who drink at least twice a week and go out socially at least twice a week engage in binge drinking. And so this council came together and decided to put together some PSAs using Shaquille O'Neal, and also a comedian called Jeffrey the Comedian, to bring awareness on HBCU campuses. So let's take a listen to a clip from Shaq.
Because there's a lot of stories that, people, get drunk, drive, and, the stories are tragic. The problem with children and, our people is, let's just say last year I went to spring break, and me and my good friend Tony, and we had 6 or 7 drinks, a little bit drunk, way above the limit. We drive home, we make it. Now guess what that's gonna do to us mentally? It's gonna give us this Superman feel, and we're gonna feel like we can do it again, and we can do it again, and we can do it again. But you can't do it again, because the ones that have had that Superman feel, they met their kryptonite.
Dr. Clarke, you've seen people who've met their kryptonite in your emergency room.
Yes,
Can talk to us about what goes on, and give us a kind of a composite of who may come into your emergency room after binge drinking.
Well, usually the average patient coming in after binge drinking is coming in complaining of a lot of nausea, vomiting, upset stomach. We tend to use the term alcoholic gastritis, where, if they've been drinking for a significant amount of time, and I'm not just talking about one social event, this has been going on for several months or so, they're starting to erode the lining of their gastric mucosa inside the stomach. and they tend to really just can't stop vomiting. Then the acid is starting to reflux back up into their esophagus, and they have esophagitis and a lot of burning and what we call GERD, or gastroesophageal reflux disease. You find that these patients really need hydration, anti-nausea medications, and sometimes some what we call Pepsid or proton pump inhibitors or so forth, just for a week or two, sometimes even less than that, is usually what you find yourself treating in the emergency room setting.
Is that considered the same as alcohol poisoning? Is that the same thing, or is there something different? In other words, when they come in, they're throwing up, they're doing all that. Is that different? Is that considered alcohol poisoning, or are there other symptoms to that?
There usually can be other symptoms with alcohol poisoning, because sometimes you get to a very, very high level and you start seeing other sequelae of a large ingestion of alcohol. And sometimes I don't want the public to get confused, because when you think of alcohol poisoning, there's different types of alcohol as well. So then you start to get into some technical areas.
Okay, because I guess what I'm asking is if you're at a party and somebody's been drinking and they pass out, do you just let them sleep it off, or do you take them to the emergency room because something else may be going on? How do you know when it's to that point that they need to come see you in the emergency room?
It's individual, depending on the person. I've had friends, colleagues. I actually remember one person who died from who was a very close friend while we were in college, who was binge drinking, got taken home to the apartment, lay down in bed. No one checked on him until the next day, and they found him, dead. Apparently, you don't know what happened. You have to theorize whether or not he had a seizure and then aspirated or something else like that, or if he just choked on the vomit that he was found in. But it's significant. That's happening a lot on our college campuses. So I usually find that most patients don't come in seeking any type of medical assistance in the emergency department. They have to either wake up the next day and say, man, I feel really, really bad. I need to go see a doctor or so forth. It's usually what's happening.
Dr. Newby.
I think one of the things to that point is when you drink to a point that you're essentially unconscious, that one of the biggest issues you think about, you put somebody in the bed, depending on how you lay them in that bed. If you think about somebody that can't even move, because I've seen some patients that are so intoxicated that, they can't even move. You have to physically move them almost like they're dead weight. And so if you put them, like, say, face down, and they sitting there with their face on this pillow and nobody moves them, and they may actually just suffocate. You could have almost anything can happen in that situation because you have no control of your faculties. So that usually, if you're thinking about when you're asleep, if you're in a position that creates numbness or something, you're typically going to wake up enough after pain to move and to turn or to whatever. But when you talk about that kind of deadening effects of alcohol, you may not move. You may just sit there, and that's what happened. And I know, the last time I worked in the emergency room was when I was a resident, but I did my training at Emory in Atlanta. So at Grady Hospital is like the big county hospital down there in Atlanta. And I'm going to tell you, some of the times I spent in the emergency room down there, you would see all kinds of things, but like ethylene glycol, people drink antifreeze. And, that's the thing that you don't know what they had. You just assume that, and I don't know if you even see that anymore these days, but I know when I was coming through, I'm feeling old by the minute, but, we used to see a ton of ethylene glycol ingestion poisoning as a result of that, and that causes kidney failure and all kinds of things. So, it depends on what they had.
What they're drinking. 440-2665 or 1-800-940-2240 are the numbers to call to join our conversation today. We're talking about binge drinking and how we can prevent it, what it does to the body, what you need to think about as you are preparing for the holiday season that's coming up. 440-2665 or 1-800-940-2240. So let's talk about some of the things, if you're binge drinking, that go on within the body. I know that it can lead to heart disease or heart attacks and things of that sort. What else does it do to the body when you binge drink?
Well, I think
Either
like
one,
anything
Dr.
else.
Clarke?
Well, I mean,
Go
I
ahead.
think
Dr.
anything else
Newby?
brain cells start to, to go if you ingest but so much. That's why I think people get memory loss, and is a longer lasting effect. It's not just after you do it once time, because most people that binge drink, they're multiple. They do it a lot. And after a while, they do say it does affect brain cells and athletic performance. When you think about athletes that drink a lot, it's going to affect their performance in terms of what they're really hired to do. So I mean, those are some of the few things I know. I'm sure Dr. Clarke could elaborate.
Well, you have to think about the short-term and long-term effects of the alcohol on the body. And in the short term, you have really symptoms that come and go. I touched on earlier just nausea and vomiting, acid reflux, upset stomach. Potential people then can develop alcoholic-related pancreatitis, which is the pancreas gets affected and gets inflamed. You start seeing long-term issues as far as liver damage. And we have a lot of young patients who are now coming in with alcoholic hepatitis and alcoholic cirrhosis that they develop after years and years of binge drinking or just being alcohol-dependent alcoholics. So that spans a big spectrum of that long and short-term type of effects.
One of the things that the study also found was that that people who party or attend HBCUs party differently and drink differently than those on majority campuses. Let's listen to Gregory the Entertainer, who talks about that.
Thing about black colleges, see, we like music, all right? So when you playing music, you playing your hip hop, you playing all your beats. See, the beats mess you up because you drinking and dancing at the same time. See, when you drink and dance at the same time, you forget how much alcohol you have. See, it's not like the white colleges. White colleges, they don't really dance. They just sit and talk, and they just drink. They're like, how many beers is this? It's my third beer, bro. It's my third beer, man. Come on, do so. They keep count, but we're like, hey, man, fill that up. Yeah. We dancing. See, that's just normal for black colleges. Music, beats, and alcohol don't work.
Music, beats, and alcohol don't work. 440-2665 or 1-800-940-2240. Mike joins us from Williamsburg. Hi, Mike. You're on the air.
Hi. I had at first just a quick, question, but now I have a comment. I'm saddened to hear what I just heard because I really don't think that, once again, there shouldn't be any emphasis on what the skin tone is, regardless of where you are in college. Because if you were blind, it wouldn't matter if you were black. And I find it odd that we still kind of add some kind of heroism, I guess, when we say that, one culture uses music differently or whatever, and we have to tie a marker to that being race, regardless of what the race is of the man that said that. But my question is, could it be that in Germany, which I spent a lot of time, their beer over there is pretty much pure? And I just have a question. Is there any possibility that the way we process beer here in America, for example, if you see what Anheuser-Busch does and makes beers 120 days shelf stable at room temperature, could there be any correlation between the disease and sicknesses and problems due to the processes and the chemicals that we add to our beer?
Okay, two things before you run, Mike. Let me explain one point, that the first point that you brought up. The study that was done was the first study that has ever been done with HBCU campuses. So that's the reason why the focus is on the differences, because they want HBCU students, particularly who attend HBCU schools, to pay attention. Secondly, my question to you is, what is pure beer versus what you're talking about, so that I understand?
I misspoke. I should say pure beer. Their ingredients are all natural and whole. For the most part.
Okay.
But on that note, I guess as an American who's multicultural, it's just kind of like when you hear about elections as well. It seems that we focus too much on race as these events happen, generation after generation. It might be more severe or less, but all colleges do it. I mean, there's a lot of.
You're right. All colleges do it.
All colleges, all people, all nations,
And that's why this information is for everyone. Thanks so much for calling, Mike. We appreciate it, and I'll let the doctors answer your question. The way that alcohol is processed, does that affect how it affects the body? Dr. Clarke.
I am not sure as far as to the ingredients that go into different alcohol beverages and how they might affect. When we look at we just look at the proof of the alcohol substance, and I can't sit there and say malt liquor has a different effect on the body as opposed to grain alcohol or something else, that or some microbrewed beer. What I just find is that it all just really changes the level of consciousness, decreases the patient's awareness, and ultimately leads to more and more dangerous behaviors.
So the higher the alcohol content in the beverage, the stronger the beverage is, the more hurt could possibly happen. Is that right?
The quicker you're going to reach that level of intoxication, definitely, and your ability to now process what you're doing, and maybe even making the decision to stop might be shaded.
440-2665 or 1-800-940-2240. James joins us from James City County. How are you, James?
Hello, how are you?
Doing great. What's your question or comment?
My question is, when you drink certain drinks like gin or rum, you're left with a hangover, a headache. And I wonder what ingredients certain alcoholic beverages contain that cause this headache, and what is causing the headache? What happens in the headache? Is it vessels dilating or what?
Okay, we'll see if our doctors can answer that. Thanks so much for your call, James. Do we know why, when you get a headache after a hangover, what the cause of that headache is? Either one? I don't think our doctors know the answer to that. Go ahead, Dr. Clarke.
Usually what the alcohol is doing is having an effect on the microvascular system, the blood vessels inside of the body, including the brain. And with alcohol crossing the blood-brain barrier, it now increases that pressure. So you're usually finding yourself having a headache, most of the time necessarily due to elevated blood pressure, which is going to be transient. And different people develop different levels of tolerance. So someone who's been binge drinking a lot or have a significant dependence on alcohol, they probably will not have a hangover and that severe headache. I've had patients presenting to the emergency department there at DePaul who drink a variety of different things. There's people who just drink beer. There's people that just drink bourbon or some other vodka and function very well in society and don't have any sequelae that our caller is mentioning. So I would say that the headache it just depends on the individual.
So, Keith, as you're working on various campuses and you're working with students, what are some of the things that you all are seeing in terms of binge drinking?
Well, I think the biggest concern has been when if we're involved with some of the parties that they have. What we're seeing is a lot of the young kids are coming in, and you made a very good point earlier, or I'm not sure we did it off air, about when the drinking occurs. One of the things we found in when I'm involved in a HBCU versus a non-HBCU, the kids have the drinks outside of the festivities, and they come in, and they're fine when they first walk in the door. But as the night progresses, you see the change, and it's usually early on because I think they had all the drinking before they came there, so it hasn't really taken its full effect until they've actually gotten there. So and you don't see any alcohol at the place. I mean, there's nothing there because they had it before they got there.
Because they drink before they go to the event.
And I've seen that pretty characteristic. The biggest fear I have, and the reason why I even brought this up to you to discuss, is that we're seeing a lot of women who are the majority of the people that we're having to take out of the parties and keep, in the room, because we have separate rooms in these different facilities where they had allowed to sleep it off. And I get my biggest fear is women, because they can't always protect themselves, and women can be extremely vulnerable. One of the things that in my research, as we run into this problem, is you see that we made a comment about the 4 drinks for women, 5 for men. Well, women, they metabolize alcohol more slowly, and so it takes less, but they stay drunk longer. So they may it may ingest the same amount. They say they had like 4 drinks or 5. It may take 3 to start getting them drunk. The problem is they'll stay drunk longer. Mm-hmm. So the guys awake and sometimes do things that they shouldn't do while the woman's still out. And that's the biggest fear I have is, in this era, women, you always worry about women, their self-respect and their ability to be able to maintain and function and do the things that are important. And I hate to see something like that happen because of just bad choices on an event. So we're seeing that the women are having more issues I'm running into on actual campus. Now, the emergency room may be different in terms of what actually comes in, but what we're seeing is who gets drunk or intoxicated the quickest and the longest, we're finding is women.
The women. If you're just joining us, we're talking about binge drinking among college students with cardiologist Dr. Keith Newby and emergency medicine specialist Dr. Clarence Clarke. To that point, one of the other things out of the study says binge drinking leads to violence, unsafe sex, sexual abuse, and death. And it also costs college campuses and students hundreds of thousands of dollars a year because of equipment being broken, rooms being destroyed, things of that nature. So whose responsibility is it then to discourage binge drinking? Because is it the responsibility of the alcohol industry? Or is it an individual responsibility?
I think it's the responsibility is multifactorial. I mean, I don't think you can point the responsibility on one particular person who's the one that's consuming the alcohol. I think education is always the initial step, but it has to go and span the entire community. You have to educate the campus, campus police. You have to educate the residential dorm people. You have to educate the administrators on the campus and the teachers, and then ultimately the students as to the effect of alcohol and what it can do to the body. And once you start having that educational push, you got to equate it to what tobacco is doing to the body. I mean, there's all this news media and reports about smoking and what it's doing, but there's not a lot of stuff about alcohol and what's that doing to the body.
And how easy it is to assess that alcohol. We have a Facebook question. Okay. Go ahead.
No, I was going to say, in addition to parents, because a lot of these kids, unfortunately, so depending on the parental I guess influence. I know when I was coming up, my mom was a single parent. My father died very young, and she didn't play. I mean, it was. If I took a drink, I'm hiding because if she found out, it was. But there is a difference now. Unfortunately, so because I still am a firm believer in some of that authoritative. Because again, a lot of times now you find that parents want to be the kids' friends. And in some of my family, they go out and drink together. I'm looking, I'm like, what in the world? Anyway, but I know that's the reality of what we have. But, that influence plays because, unfortunately, so the adult has the maturity, but the children don't. So the young kids, and they don't have that ability to necessarily differentiate what's too much, what's enough.
And when you should stop.
Exactly.
To do that. We have a question from Facebook. They want to know, are the doctors seeing more health problems among younger people due to heavy drinking? In other words, other kinds of diseases. Dr. Clarke? Absolutely.
I mentioned earlier off the air where we're seeing a lot of young patients, and listen to some of the data that was given earlier. This is now affecting young people ages 18 through the ages of 40 who are now coming in with a significant amount of problems secondary to alcohol abuse or use, binge drinking definitely. And you're finding that they're having, like I said earlier, pancreatitis. They're going into having their livers being affected by the significant amount of alcohol that's being consumed, because it's kind of like a gateway. And then if you start drinking and then you're able to function, you start to do it more and more and more. And I've been part of those social dynamics where I go to the party. I went to the parties while in college, and I drank a lot. I never really drank before I got to college. And the peer pressure that you give into, you start to drink and consume. And I remember being in the back of a vehicle, and I don't remember what happened, a few hours before waking up where I woke up. How did I get here? So being a person who actually done a binge drinking before in college, I just never wanted to be that person again. But, you're definitely the peer pressure that had a significant role in it.
Wow. 440-2665 or 1-800-940-2240. Thelma joins us from Virginia Beach. Hi, Thelma. You're on the air.
Thank you. I was wondering if the doctors could make some comments about the interaction of alcohol and some common medications, like for blood pressure or epilepsy or anxiety or depression, because there are college students that take these medications, and make some comments about that and combining them with alcohol.
That's a very good point, Thelma. Thanks so much for your call. We appreciate that. Dr. Newby?
Just my experience has been with certain heart medications, alcohol can either increase or decrease absorption of certain medications. So if you're talking about certain types of heart medicines like high blood pressure pills or whatever, if it decreases absorption of the medication, it's going to decrease the effectiveness. Now, for that one period of time, may not be that big an issue. Most times for high blood pressure medicines, it's not. But what I do get more concerned with is certain antiarrhythmics. That we have certain medicines that are rhythm controlling drugs, and some of them can be pretty treacherous in terms of what they can do if you influence the drug amount in the system. So if you increase drug levels of this, it could create some dangerous heart rhythm disturbances, and it can lead to death. The other thing would be on depression medicines or antidepressants, because again, the alcohol is a depressant itself.
It's a depressant,
yeah.
right?
So I mean, if you can actually add misery to mayhem like that, so I mean, from my end, that's what I see. I'm not sure Dr. Clarke could chime in on more.
One of the main problems that I see, to touch on a couple of examples that our callers mentioned, is what I find with patients who are on the anti-epileptic medications. Alcohol definitely lowers the seizure threshold, and you find patients who are on these medications, they're now more prone to having seizures, and they're at significant risk.
And would those seizures happen while they're drunk or after or afterwards?
A lot of times while they're drunk. While they are. It leads to non-compliance with taking the medications as well. But what I find, what the effects of all medications on the body, usually the body eliminates different or metabolizes drugs either by the kidney or the liver, usually mainly by the liver. And if alcohol is also metabolized by the liver, so now you're using up that pathway, and your ability to metabolize the drug is impaired, and you find that the action of the drug lasts longer in the body, which, if you read the labels on most of the medications that you're taking, it says do not consume with alcohol, and there's a reason why. So I find that it has a significant effect on drugs and the metabolism in the body.
So I guess my question to you all is it better to just not start drinking in the first place, or is there a way to moderate? How do you figure out how to moderate where your tolerance level is?
Well, that's a good question. I mean, I and I know that's going to be each person is individualized, but I always find that, again, we talk about that maturity level, and unfortunately, so, I think, kids mature a little later now than what they used to. So, but that's where I think parental guidance is so helpful. I don't think you should be friends with your children, but you need to be their counselor, their advisor. And being able to have those kind of real conversations with them can help them, guide them in terms of what they should or should not do.
Actually, we had a caller who called in but didn't want to talk on the air, who wanted to know if the doctors think that we should be teaching kids about drinking at a younger age, and if so, what age?
Absolutely. Education needs to start in elementary school. If you start knowing it's kind of like sex education about drugs, alcohol needs to be right there as well. And you don't want to have the community finding out about the negative effects after it's already happened. They need to hear about that loved one that was lost, or a community that was changed by young students drinking and driving. I was just looking at the news the other day, and there's a family riding back from Louisiana, and the young man fell asleep, and you don't know what caused him to fall asleep. You always in the back of your mind think was drugs or alcohol involved. I have seen a lot of significant negative effects of alcohol in the our young population because there's not a lot of education out there. And the side effects and what happens to a person, not only the person who was drinking and driving, but the family effects, it's devastating. So we have to start educating the kids at an earlier age. These are the things that can happen, not only to the body, but also, affects your life going forward.
And unfortunately, so I also run into that issue of do people deem it as noteworthy? When I say that, the unfortunate reality is, I've seen where people are exposed to it, and the parents and friends encourage the alcohol use in young kids. I mean, that's something I know. I was flabbergasted when I've seen some of my friends when I was growing up. Then I was 17, 18 years old, and I go to one of their parties, and the parents are actually bringing the alcohol to the party. So I mean, if you don't really teach your kids or your children that this is an issue. I mean, but if you're not thinking it's an issue, they're not going to think it's an issue either. And that's where I really think we fall short sometimes in really educating our children to say that it is an issue. I mean, we may do this or participate in this, but there are limits.
Well, and there's also some things sometimes when, the dad or the mother or whomever will just slap the kid on the back and say, "Oh, you just had your first hangover." You know what I mean? It's kind of like this is a rite of passage and this is a good thing, as opposed to looking at where it could potentially go.
In the emergency room there at DePaul, where I work, I find most of the time the opposite. I find a parent who comes in who's very upset that their child has gotten a hold or consumed a large amount of alcohol, and they go through, different emotions, anger, grief, and everything else, and then wanting to find out how they can help their child. The unfortunate thing is once it goes back to education again, and we actually as the community need to kind of look at the resources that we have in the community and really improve the resources, because there are a lot of people who are coming in looking for assistance with alcohol consumption, abuse, and so forth, everything from binge drinking to people who are alcoholics. And there's not a lot of resources out there. There's few. And when you're referring them out to these areas, they tend to not go because they might have to wait or so forth for that assistance. So it's a significant thing.
And do you think that assistance, is that different if you're a binge drinker versus an alcoholic? I mean, in terms of what you may need immediately versus long-term help, in terms of community help. Do you think there's a difference, or is it all the same?
Well, I think like anything else with the alcoholic, at least the alcohol-dependent person may be more of maybe more of an immediate situation because, they need it like all the time. The binge drinker, like Dr. Clarke mentioned earlier, may be a Friday to Sunday thing. It may be just an event thing. I mean, it's hard to say, but I think that the severity can be the same in both parties. It's just an issue. The more immediate may be more the alcoholic because they need it all the time. These are more the alcohol dependency. They're going to be ones that need it more immediately than the binge drinker. But I think both need it equally.
Need the help. Another Facebook question: how can you tell if a friend is experiencing alcohol poisoning? And I think that's the second time we've talked about this. I think people are thinking to the point where you drink where you get sick. I think people may call that alcoholic poisoning. You, Dr. Clarke, you have a little different definition of that. Is that right?
You want to, because it could, when you look at the medical textbooks and everything else like that, yes, the amount of alcohol you consume definitely can lead to some alcohol poisoning. The things that you would need to look for in a friend, a colleague, a worker, anything else, is that, first of all, you got to know that they're drinking, because a lot of times you don't know. Some people who are alcoholics or binge drink, you might not see them go into the bathroom and consume a bottle of alcohol and they come back out. You have to be aware of what's going on with the person. Can they not keep food down? Can they not walk? Are you having to carry them? And if you're looking at that, then you have to say, well, I might need to watch this person now, and then you're stuck making a decision, and which is an unfortunate decision. But you can always err on the side of caution and say, I need to take my friend to go be seen by a medical specialist who can kind of determine, are they safe or not?
The holidays are coming up, Dr. Newby. So, and we already know we tell people not to overeat, right? But
well, we know what's going to happen there, though.
but talk about drinking in the holidays and how all that comes together.
Well, it's all kind of part and parcel in the same thing. You almost can binge it with, with holidays as well. The eggnog comes out and these other drinks. And I saw an article in actually interesting. It's a health magazine. They talk about it. I saw this the other day. They listed like 12 different alcoholic drinks for the holidays.
A different one each day for the 12 days of Christmas, right?
And I couldn't help but laugh when I read through it. But when you see that, though, again, this is our society. It does encourage this type of behavior. And again, how much is too much? I mean, there's a definition I happen to look up about, when they say, somebody says like, I have a drink. What is a drink? How much is that? And what they said was that's 12 ounces of beer, which beer has 5% alcohol, 5 ounces of wine, and most wine is about 12%. But they said 1.5 ounces of a distilled spirit, which is roughly about 40%, alcohol, depending on the how they produce it. So when you talk about I always tell people all the time when somebody asks me about, how many drinks should I have? I say, well, can you deal with just one? What I mean? And they say, I guess it's not like Lay's potato chips, But I mean, I always say if you're going to have it, take your one and nurse it and then call it a day. I mean, do you really have to have more than that? I mean, because again, but everybody's got a different feeling about that.
I'm going to try to get another call in before we have to end this segment. Ed joins us from Yorktown. Hi, Ed. You're on the air.
Hi, great, thanks. You were discussing alcoholism and the craving, and to me, the alcoholism is really more along the point of you get in trouble, and what would you call somebody who grabs a hot pot and burns their hand continuously? They don't have a craving to grab that hot pot and burn their hand continuously. If you go out and get drunk and get in trouble all the time, what would you call that?
Okay, we'll see if we can answer that question, Ed. I'm not quite sure. I guess he's saying if you repeat the habit over and over again, does that mean that you're becoming an alcoholic, is what I take from his discussion.
Well, I don't know all the definitions of cardiologist, of course. I don't really deal with that as much, but I would think anytime you feel a continuous desire, to do something that is causing detriment to you, it's like, food addicts, I mean, we have all types of addictions, tobacco, but I think if you are at that point where you feel you have to have this in order to function, I mean, it's part of your everyday life. I mean, we all know we have things we do that we have to do as part of our everyday life, but there are other things we don't have to have. So, I mean, I think if you feel at that point where you have to have this, you have to do this in order to function, I mean, I think there has to be some form of addiction, coming into play. Yeah.
Okay, we have about 4 minutes left, and I want to ask you guys this question. Do homemade remedies for hangovers work?
I'm gonna let Dr. Clarke answer that one.
What can you do to get rid of a hangover, Dr. Clarke?
I've seen a significant amount of home remedies, and I'm the first to say I'm an osteopathic physician. I believe in homeopathic medicine and treatment and so forth. So there is a lot of different things that do work. If you take it down to the bare bones chemistries of what you're doing, you're pretty much sometimes creating the same type of medical cocktail that might be used in a medical setting in an emergency department or so forth. So there are different things that you can do. I am not going to sit there and advocate for any home remedy because there are going to be different sequelae and side effects that you might have to worry about. Please don't go out and start drinking baking soda and everything else, folks.
No, we definitely don't want to do that. What about you, Dr. Newby?
That is way over my head, I think, to know about the home remedies. I've had a hangover once in my entire life, and that was in college at the time. And this as Clarke mentioned, Dr. Clarke mentioned earlier, once you do it once, nobody had to tell me this. I was done. I said I was over and done. I think after I had that hangover, I didn't have a drink till I finished residency. I'm talking like 9-10 years later. I mean, it was just that was all I needed to have. I mean, that was the worst headache of my life, and it lasted all day long. From like I woke up to I think 6 that evening, and it was just I said I'd never go through that again. So after that, teetotaler.
Okay, in the last minute or so that we have, just some advice that you would give to people, especially since the holidays are coming up, Dr. Clarke, in terms of drinking. Don't drink and drive, definitely. But what else?
I would like to, commend the different organizations that are been out there educating against, alcohol abuse and drinking and driving. I find that the conversations are happening more and more, and colleagues, peer groups, and so forth. People are creating designated drivers and so forth. Now it's time to take it to another level and talk about the effects of alcohol on the body. And we as a community really have to start educating the community about the effects.
Okay, that's Dr. Clarence Clarke, an emergency room specialist with Bon Secours DePaul Medical Center. And in all disclosure, I am a board member of Bon Secours. So I just want to get that out there. And Dr. Newby, you got about 30 seconds.
Yeah, just a couple of quick things. One is that they say alcohol use is implicated in 1/3 of all drownings. Alcohol is the number one date rape drug. I mean, 1/3 of all suicides are associated with alcohol misuse. I look at it as you hear the numbers, you hear the things that happen. I just really want to just ask people, don't throw caution to the wind. Understand what you're getting yourself into and what it can do detrimental to you.
Okay. Cardiologist Dr. Keith Newby, who joins us every fourth Friday of the month for another view on health. Gentlemen, thank you so much, and we will be right back.
Thank you.
Don't go.
I'm with Marcellus, and you all are checking out Another View on WHRV 89.5. Don't go anywhere. Check us out.
Thank you, Wynton Marsalis. He's an author, screenwriter, director, and professor. Booker Madison has learned from the best and now shares his knowledge with college students. He recently sat down with our Lisa Godley to share his story along with a few words of wisdom.
I call myself an accidental novelist, even though writing is something that I've done for as long as I can remember. I was creating characters as a very young child. I created this cartoon strip called the Working Ticks. So often my brothers would come over, I'd be over playing by myself, and then they would come over and start playing, and then I would direct them, as it were, according to the characters that I created.
In fact, by the time he was 9 years old, Booker Madison had completed his first novel and sent it to Connecticut's Institute for Literature.
When they sent back a letter saying that they had accepted my manuscript, I was kind of scared and concerned because as a 9-year-old, I thought I'd done something wrong. So writing has been with me for a very long time.
In college, Booker majored in mass communications, and one day, while working as an intern in a television newsroom, had an epiphany.
I discovered, I'm not as much interested in covering other people's stories. I wanted to tell my own. And it wasn't until then that I said, well, maybe I should consider film school. Now, at that time, I was seriously pursuing a rap career, so I only applied to NYU, but because the demands of the program were such that you couldn't do both things, I had to choose. But because I was vested, as it were, because of the high tuition, it was a very easy decision to let rap fall by the wayside and then focus fully on film. I often say that my first year in film school was probably the best and worst year of my life. The best because I was able to continue to develop as a visual artist, communicating with images. But the worst because I had to reconcile this idea that you're not as talented or as smart as you thought you were.
Booker absorbed all he could while at NYU, learning from the likes of Spike Lee and Martin Scorsese. His skills led him to write the screenplay and direct the film adaptation of the 1933 classic story The Gilded Six-Bits, which aired on Showtime in 2001. All the while continuing to write his novels, first Unsigned Hype, and eventually crafting Snitch, which was published in 2011.
Snitch, it's the story of an overnight bus driver who witnesses a crime on his route and the moral dilemma he faces as he wrestles with the decision to keep quiet to save his job or to talk to save himself and his family. This novel earned a Publishers Weekly starred review, which is the holy grail for authors, so that was very exciting. And lots of production companies, they came sniffing around because people, not just in publishing but also in Hollywood, read the Publishers Weekly, looking in particular for those books that get star reviews.
Booker, who now teaches directing and film writing to students at Regent University, says he uses his own life experiences to help his students.
One thing that I told my students that you have to be prepared or you will miss opportunities. And if you have a great short film or a great project and you don't have a feature script, then it's a different conversation and you've missed an opportunity to be at the table. You can't stand in front of students for 3 hours and pull the wool over their eyes. You have to be sharp. So over the last 4 years, I've actually become a better writer-director teaching, which has been a really great preparation because all of these things are beginning to coalesce right at the time where now, as I've told my students, I have both of my scripts prepared and I'm ready. So my feature film or films will be better now as a result of the last 4 years of teaching at Regent than they would have been had I not taken advantage of that opportunity.
Both Unsigned Hype and Snitch are currently in development at Homegrown Films, which produced We the Peoples and Hustle and Flow. Booker says his best advice to anyone interested in writing novels or screenplays is to do it and do it consistently.
Practice, because it's only through that practice that your voice will be unique enough that someone will be willing to pay you to have it heard. If you really enjoy storytelling and you really love it, you'll tell stories, even if it's in your church, even if it's community theater, even if you're, getting, the multi-million-dollar deal at Warner Brothers. If it's in you and it's something that you want to do, you'll do it.
For Another View, I'm Lisa Godley.
And Lisa's story was produced by Austin Bell, a former Another View intern who was a student of Booker Madison's when he studied film at Regent University. Before we leave you today, let me tell you about 2 Thanksgiving Day events or Thanksgiving events happening in our community. For more than 15 years, the Southeast Community Day Planning Committee has hosted the Feeding 5,000 Thanksgiving Harvest and Community Celebration. And they are doing it again tomorrow, November 21st, from noon until 4 at the United House of Prayer for All People, 1811 Ivy Avenue in Newport News. It is free and it's open to the public. And the Buffalo Family and Friends Community Day's 5th annual Thanksgiving Community Dinner will be on Wednesday, November 27th from noon until 3 at 513 B Street in Chesapeake. It is also free and open to everyone. Speaking of Thanksgiving, the Another View crew will enjoy some time off to celebrate with family and friends, so we won't be with you next Friday. Instead, enjoy the program Giving Thanks, a celebration of fall, food, and gratitude. You'll hear a Thanksgiving blessing from the late Dr. Maya Angelou, and Nikki Giovanni shares some food poems along with other Thanksgiving memories. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Victor Bowen is our audio engineer, and Kamaria Mason answered our phones. Thanks so much for joining us today. And as we approach this Thanksgiving and holiday season, that you'll give thought to how much alcohol you consume. Please don't drink and drive. Stay safe, everyone. Happy Thanksgiving, and we'll see you in 2 weeks for Another View.